Umoru is very important. Age, this is your genetics. And so that's one thing that, especially if you're faced with, very important as much as you are, but you must, in meat, plants, those chicken, fish, something that there are some studies that have been done in this. One came from eat transferred are more likely to have fertility, should indulge in such rather than people who are always hitting hard on red meat. So diet is important. There is no doubt about that. Flora, IVF, it's possible. You can conceive. If you're going to conceive on your own, without ovulation, it's not likely that you're going to conceive. Another question from Solomon Archie: can a woman over 50 years of age be pregnant for the first time in her life? She has been married for 16 years now, but I'm probably be thinking of doing IVF. Especially to conclude, you said our menstruation has stopped for about 3 years now. So definitely, can a 55-year-old woman conceive after giving birth to two? That you still need to, each pregnancy is a different ballgame, likely to be available, and therefore iterate to Ekene Anatrunam. She says, how can I achieve pregnancy program a lot? But if you have polycystic ovarian, and diet also comes in with this, it's known that gluten is not good for PSs, that you are not ovulating regularly, and the doctor to be sure that even the sperm, that if when you ovulate, the sperm that is to have a proper assessment, and then we take it from there. And then Fatima Aremu is asking almost the same question, but in a different way. You can. Yeah, it's just that the doctor has to be very careful in hyperstimulation, which can be something which is because now we have regimen that can prevent this hyperstimulation from happening. So, I told you we have tried to group all the questions together. So the next question also is on PCOS. And Augusta Okoye is asking, how can someone who is having PCOS and amenorrhea conceive? Okay, you need a good assessment to see, because sometimes we only see one problem when there are two or three. So the only way that we can see all the problems is to have a good assessment to start with. And then once that is done, we can see whether it's only PCOS that is a problem, or for example, there is also a male factor problem. So there's so many, we need to have a good assessment, and then you need to see a good doctor to be able to lay this to rest. But people with PCOS, they do get pregnant. Of course, you know that there's some other things also. PCOS is a lifelong challenge, because even when you have had children, the chances that you can have diabetes is higher in later life. So your diet is something you have to be on top of throughout your life. And then Elizabeth Oladipo, how can one get pregnant with endometriosis? Okay, first of all, let's be clear. The fact that you have endometriosis does not mean that you will have infertility. 70% of people who have endometriosis do not have infertility. They do get pregnant. So, but if you have infertility, you are part of this 30%, then you need to see a doctor. And one thing that is of importance is that time is of essence when you have endometriosis with infertility. And one thing also, that even when you don't have infertility now, let's say you are not ready to start raising a family yet, one thing now that everybody is talking about is that you should be storing your eggs, because we know that the egg storage might just be something that will give a lot of respite to people who have endometriosis in later life. Okay. Then there's another question. Okay, this is from Instagram, and is asking, what are the causes of ejaculation without sperm coming out? Okay, now that's a very important question as well. That could happen after so whether you have some medical conditions could cause that. For example, diabetes. Multiple sclerosis can also be one of the things that can cause that. Okay. Then also, if there's some drugs also that when you're using that could cause that. There also some surgeries that you do, especially surgeries around the prostate, can also cause that. But the commonest reason why that happens is a condition that we call retrograde ejaculation. It does not mean that you are not ejaculating. It does not mean that there is no semen, but it's going the wrong way. Okay, and but if you see a doctor, what they do is to check your urine, because in such cases, the semen is going to the urine rather than coming out through the urethra. So they can check the urine and see whether there is sperm there, and the doctor will know what to do about that. Okay, I think I still have a few questions, but I might soon be drawing the curtain and then answering the other questions on the page. Olushola Atil is that, what are the causes of recurrent miscarriage or pregnancy loss in a couple that has 2 children? Yeah, that's one thing that we say, is that every pregnancy is different. So it's what is happening at that point in time that we need to consider. Okay, so when you are having recurrent pregnancy, what we refer as recurrent pregnancy losses will be that you had 2 or 3 pregnancy losses, okay, and either from the time that you get pregnant to about 20 weeks, that's we regard that as recurrent pregnancy loss. And then, but you have said something here that is also very important, that the mother is close to 40 years old, and one of the reasons, the commonest reason, is age. You know, a miscarriage is higher than the chances that she will carry the baby to term, because of the fact that the eggs are aged, and because of the aging, a lot of accidents could happen. So, and that's why we're always talking about age and infertility, because with age, it's not only you getting pregnant, even carrying the pregnancy to term, it's also can be affected by you have a woman who is left with one fallopian tube and has gone through 4 cycles of IVF but failed. One thing you did not tell us is the age. Maybe that's the question, the problem, or the quality of the embryos that is generated, which can be dependent on so many things. Oh, can she still conceive naturally? We never say never. It's possible, but how long are you going to wait? That's the question. So I think it's to probably do IVF again, but to do IVF. But if you want to wait naturally, which is not guaranteed, you can also do that. But that will be my response to that. Okay, I think I'm probably going to take my 1 or 2 more questions. And how can one improve sperm production? Well, that's a tough one, in the sense that, yes, lifestyle is the only thing that you can do to improve your sperm production. For example, there are some things that are known. We know that people who are overweight, obese men, sperm parameters are lower than people who have ideal body weight. People who smoke, whether it's cigarette or it's recreational drugs, we know that their sperm parameters are worse. So it's better when all these things are the things that you can do to improve your sperm production. The kind of underwear you wear, it's the kind of sports you do, don't overexpose your testes to too much heat. Those are the only things. But I know where you're going to will be drugs, and there is no evidence that any drug improves your sperm production for now. Okay. Yes, you could take some vitamins, yes, maybe, but there is nothing that says that, in science we always talk about evidence-based. There is no evidence-based drug that will make you improve your sperm production. Yes, micronutrients might help. And this last question will be, what is the best way to go about the treatment of oligospermia? Oligospermia is low sperm count, okay? And I think I've answered that with the question above. It's the same thing, that you should, this lifestyle that, okay, I'm being told that I need to take 1 more because what are the chances of successful IUI for a woman who is 35 years old? Yes, IUI is intrauterine insemination, yes, but there are conditions that must be satisfied before you even talk about success, because that's one of the problems with the intrauterine insemination. The tubes have to be open before you can qualify for IUI. The sperm count has to be optimal or almost optimal before you can do IUI. And so those are the things that we need to look at. Once you can, those things that are there, then you have about 15% chance per trial of intrauterine insemination. So that's that. But the most important thing is that the conditions that can even make you succeed must be present first before you start talking about IUI. Because I see some patients whose tubes are blocked, and they're asking for IUI because they say that's the only thing I can afford. It doesn't work that way. If your tubes are blocked, doing IUI is a waste of money. If the sperm count is very low, doing IUI is a waste of money. So I think that's where I will end this program today. Thank you so much.